So today my video is going to be on the pulmonary artery catheter. This is a balloon-tipped catheter. It measures the central venous pressure, the pulmonary artery pressure, the pulmonary capillary wedge pressure, and then the cardiac output, and half of that, the cardiac index. The distal channel is going to measure the PAP, the pulmonary artery pressure. The proximal is going to measure the central venous pressure, and then the balloon inflation is going to measure the pulmonary capillary wedge pressure. This can be inserted brachially, femorally, or through a jugular vein. And so once it enters the vein, it goes into the right atrium. The balloon is then inflated and continues through the right ventricle, and then it goes into the pulmonary artery. This is where it wedges into like the distal branch. After this, the pulmonary capillary wedge pressure can be recorded and the balloon can be deflated. So the CVP, so this measures the right arterial pressure, and this also reflects the systemic venous return. The normal for this is going to be 2 to 6, and these are all Lindsay-Jones values, the normals. The pulmonary artery pressure speaks for itself, but it's really important to monitor critically ill patients with someone like ARDS. So definitely monitor the PAP when you're doing this. The normal for this is going to be 13 to 15. The pulmonary capillary wedge pressure measures the left side of the heart pressure. The normal for this is 7 to 9. And the cardiac output normal is 4 to 8, and the cardiac index is half of that, which is 2 to 4. So, made this little chart. And so you're going to see problems like these if you're trying to pass like your boards. So this is just like a little review, and it's going to help distinguish after you like learn your normal values, you're gonna realize which ones are abnormal, and you're going to be able to see like where the problem would lie. Once you determine where the problem would lie, you would be able to see what disease that would be causing these abnormal values. Okay, so this is just a chart that I learned how to do. You're going to write your CVP, your PAP, PCWP, and CO. And in between these, the problem is going to be your right heart, the lungs, or the left heart. So for instance, if you were writing down your values, and you notice that the CVP was in normal range, the PAP was increased, and the PCWP was decreased. Since we're looking for the trend of high to normal or high to low, you would know that the issue would lie within the lungs. And then if you had a question and it was the CVP was high and then the CVP was low, you would know that the issue was within the right heart, and so on. If you did have a question and the problem would lie within the right heart, you would think that the disease would be like cor pulmonale. Some issues with that would happen within the lungs would be a pneumo, pulmonary embolism, air embolism. You could have hypertension or increased pulmonary vascular resistance. This would be like a COPD. If your issue was within the left heart, you would think congestive heart failure, maybe pulmonary edema, mitral valve stenosis, or it could also be negative effects of the ventilator, so like your increased PIPs and your increased PEEPs. Also, if I can't remember if I said it, but if all of your values are increased or all your values are decreased, this could also mean something. If they're all increased, that could mean fluid overload, so you would just diurese your patient. And if they were all decreased, that would mean dehydration, so you would just give blood or fluid, whichever the patient would need.